Over the last 3 years, I've helped GP trainees pass a final MRCGP exam. These include first-timers, recent candidates, IMGs, and UK graduates. In this video, I'm going to share with you 10 actionable insights so you can smash your MRCGP SCA exam, saving you the guesswork, saving you a lot of time. Let's dive into the first one. Just as a compass helps explorers navigate challenging terrain, self-awareness equips high-performing GP trainees to tackle problems in their consultation. High-performing candidates are aware of their areas of strength and weaknesses. When you know your areas of weaknesses, you can work on them and you can refine these areas. High-performing candidates recognize that they have limits to their knowledge and skills. They recognize that they have blind spots, so they seek feedback and gain more awareness and insight so that they can learn and grow. Next insight, we have listening. Most GP trainees think that listening is a passive activity. When they're in the consultation, they might be listening, but they are not actively listening. Active listening is different to passive listening, when you're listening just to respond, or you're listening but at the same time you're thinking, what question should I ask next? When you're actively listening, you're engaged in the consultation. It's as if the patient is at the center of your universe. You're listening actively to every word that the patient is telling you. You're also observing the body language and the verbal and non-verbal cues. So active listening is really important. This is something that most people overlook in their communication. Most people talk a lot in data gathering and they don't listen enough. Great communicators understand the value of listening. When you actively listen to your patient or the simulator, you'll be able to pick up cues that you might not pick up if you're not listening actively. High-performing candidates acknowledge so that the patient understands that they're listening. They might be nodding, they might be doing some body language signal to show that they're listening to the patient, encouraging the patient to tell them more about the story. In the beginning, it's so important that you make sure that you actively listen and don't interrupt the patient. Insight number 3 is learning from mistakes. High-performing candidates learn not just from their own mistake, but they learn from other people's mistake. When you're learning from your mistake, from other people's mistake, you're saving yourself hours of trials and error, because you don't have to go through the mistakes and doing it, but you learn from other people's mistake. A great way to learn from mistakes is to analyze the feedback statement. The feedback statements are there to show you what are the common mistakes that candidates make. So when you're learning this, you can reverse engineer your consultation so that you avoid these common pitfalls, and that will save you a lot of time and energy. Insight number 4 is embracing feedback. Successful GP trainees receive feedback with an open arm. They know that feedback is going to help them to refine the consultation and keep learning and progressing. Without feedback, you might keep doing the same thing, practicing and practicing without seeing progress. So it's so important to make sure that you're seeking honest, constructive feedback while you're recording your consultation, so that you know what exactly in your consultation that you need to refine and adjust. Without this pair of fresh eyes or somebody else to give you this constructive feedback, can be very difficult to identify your blind spot. When you receive feedback, do you flinch or do you embrace this feedback with an open arms? During my training, I made sure that I sought specific feedback. I had a discussion with my supervisor explaining the problems I had in my consultation and identified areas together so that we could make sure that during these role plays, I was getting out most from the feedback. One of the things that high-performing candidates do is that they reflect on the feedback that they receive. It's really important that you not only reflect but make adjustment and implement that as soon as possible, so that you keep refining your consultation. By making incremental improvement day by day, you're going to have a compounding effect in your consultation. So it's very important that you make this small refinement, and when you add all of these together, it's going to multiply the effect. Are you struggling with your consultation skills? Maybe you need help and you want to get constructive feedback. If you'd like to get help, then click the link down the description below to see whether I can help you. If I can help you, then we can enroll you on the one-to-one coaching program. Insight number 5 is to concentrate on the person in front of you or the person that you're speaking. It's very important that you don't get so overly conscious about yourself and you keep the spotlight on yourself such that you're not really in the consultation. You're in your head and you're so preoccupied by various things and you're not giving person-centered care to the patient. So very important that when you're consulting, make sure that you focus on the patient, because sometimes what happens is that some GP trainees, they are so worried or thinking about various things that they are saying things, but they don't mean what they're saying. When you don't mean what you're saying, you're just saying it as a stock phrase or in a formulaic fashion, then the simulator is going to pick up on that, and you're not going to do well if you just say things without meaning it. A quote that encapsulates this concept is from Maya Angelou. She said, "I've learned that people will forget what you said, people will forget what you did, people will never forget how you made them feel." So when you're consulting, remember that the emotion, how you're making that simulator feel, is very important, because people don't forget how you make them feel. A common practice among high-performing GP trainees is a use of a receipt. For example, if a patient tells you, "This headache is terrible, doctor," by giving a receipt to the patient, you're going to acknowledge the pain that they're going through and also show the patient that you understand how they're feeling. So for example, you might say to the patient, "I hear you, Mr. Smith. This pain sounds awful." By saying this to the patient, you're showing that you're genuinely clear for this patient. Insight number 6, developing a consultation framework. Have you ever wondered why some GP trainees, they don't miss things and they always go through a very systematic process when they're consulting? This comes down to having a clear structure. When you develop a clear structure in the back of your mind, you're not going to be taking a history where you're going and jumping back and forth and you're missing things. It's so important that you use your time to prime the case beforehand and have embedded good structure such that it becomes like a second nature, so that when you're consulting, even under the exam condition, you're going to have a clear framework how you proceed. Even if you're getting very challenging or complex scenarios, you know what you need to do at minute 2, at minute 3, and you're not going to be fazed by any of the things that might come your way. Even though if you might feel like there's something that comes that you don't know, then by having a clear structure, you will be able to find a solution and possibly get some marks in that scenario. Insight number 7 is the art of refinement. High-performing candidates know that it all starts in the preparation. When they're preparing for the consultation, they analyze, they review the consultation, and they seek feedback to keep improving it. Most people, when they're analyzing and reviewing their consultation, they do it at a very superficial level. Highly successful GP trainees analyze a consultation in depth. So what they do is that they analyze not just by watching the recording, but they analyze first the audio. They listen to the audio. The second way that they analyze it, that they might just watch the video without the sound. So they pick up on the visual cues, what they're doing, and also what the patient's visual cues are. And the last step is by analyzing the transcription of the consultation. When you transcribe your consultation and look at the phrases that you're using, the language, where exactly in the consultation that you're using psychosocial questions and you're asking about ICE and how is your organization, by highlighting what you're doing, then you will be analyzing your consultation in more depth, and that will help you to have a good understanding of how you consult. And high-performing candidates, they don't compare themselves with others, but they compare themselves with how they did maybe 2 weeks or 3 weeks ago, so that they can analyze whether they're progressing and they keep track of that progress. So if you're progressing by 1% every day, by the time that you're going to sit the exam, then that will compound. So it's very important that you analyze your consultation and don't just watch the consultation, but analyze it in more granular level and use a statement from the feedback statement and see what are the things that you need to improve. Insight number 8 is early preparation. High-performing candidates give themselves enough time to plan their revision so that they can prepare strategically. They don't just take the exam and wing it. They plan it strategically. They use their study leaves, they use their study budget, and make sure that the preparation is solid. So if you're planning to sit the exam and you want to score well, make sure that you give yourself at least 4 to 6 months so that you're planning your revision, and you might need to increase the cadence of your revision revision session as the date of the exam approaches. So if you just go and don't have an organization in your preparation, you're not going to score very well. If right now your preparation is just doing some cases in a study group here and there, and you're not really deliberate and intentional in your study group, and you're practicing with an intent of improving areas of weaknesses and having a plan, then you're not going to get the results that you want. It's important that you not only organize your revision, practice intentionally, and make sure that you have study goals and keep track of your progress. If you'd like a system to organize your revision so that you have a step-by-step guide in your preparation, feel free to download the SCA Companion. Link down in the description below. It's completely free. You can start using it. Insight number 9 is mastering time management. Many GP trainees struggle to consult within 12 minutes, but high-performing candidates have managed the time effectively. They know exactly how to consult within 12 minutes, and they give themselves enough time in clinical management, at least 6 minutes, so that they don't rush and make a plan that's not sufficient or adequate. To consult within 12 minutes, it's vital that you analyze your consultation and identify which part of the consultation where you're wasting time. It could be that you're using poor use of questions of open and closed question balance. It could be that you're not asking pointed question, or you're wasting your time summarizing excessively. I've done a video on time management. If you want to watch it, click up in the link and you can watch it. Insight number 10, don't chase perfection, but pursue excellence. High-performing candidates are not chasing perfection, but they're pursuing excellence. They're improving, they're getting better, but they are not so obsessed about having the perfect case, because perfection doesn't exist. Successful GP trainees work and give their best, and as long as they can give the best that they can do, then they're not worried about the outcome. They know that if they've done the work, they trust the work that they've done, then when the exam comes, then the results will show itself. Here you have the 10 insights to help you smash your exam. If you find this video useful, you might want to watch the next video in which I go in much more depth on time management. If you're struggling to consult within 12 minutes, this is a video you don't want to miss. I'll see you on the other side. Take care, everybody. Bye-bye.